KCTV5 stands for you as we follow major vaccine news today. Every American eligible for a vaccine may soon be able to get a third booster shot. Top health officials in the Biden administration are expected to recommend that additional dose 8 months after you become fully vaccinated. KCTV5's Carolina Cruz is live for us now with what doctors at the University of Kansas Health System have to say about that topic. Carolina?
Good afternoon, Carolyn. Well, Pfizer and Moderna both submitted paperwork to the FDA yesterday. So now both drug company makers are waiting for the agency's approval for that third shot for everyone.
Health officials are not currently recommending boosters for the general population, only patients with weakened immune systems that are compromised.
We aren't so much worried about infection as we are hospitalization, severe disease, and death, and these vaccines still continue to do that.
Doctors at the University of Kansas Health System fielded questions from the community Tuesday morning. Dr. Dana Hawkinson heard from someone who was worried about getting another shot in less than a year.
There's 9 or 10 components to those vaccines that are readily available on the FDA site, and the amounts that you get of these components of the vaccines is extremely minuscule to other things that you may ingest daily.
He emphasizes the vaccines are safe. The plan of a booster for the public would only apply to patients who received Pfizer or Moderna's COVID-19 vaccine. Johnson & Johnson hasn't filed paperwork for that.
But the official wording from the CDC and FDA is really there isn't enough data to assess Johnson & Johnson at this time point. So we do understand that Johnson & Johnson is a one dose. There is very little data about the Johnson & Johnson vaccine, so we are still waiting for that information.
Doctors say there's also little data about mixed dosing, so they advocate for consistency between the shots.
Our recommendation is that they receive the same that they received previously. If they're not able to access that, there is a caveat in the CDC recommendations that they can receive an alternative.
According to Pfizer, a third dose results in higher antibody response and more protection against COVID-19, especially within 6 months to a year after the first 2 doses. If a third dose of Pfizer and Moderna is approved for the entire community, Dr. Hawkinson believes it could resemble what we saw earlier this year with the first doses.
Moving forward, there will be certain criteria for patients to receive additional dosing or booster dosing, and it probably will be based on age, probably other comorbidities like diabetes, like kidney disease, like lung disease and heart disease as well.
Researchers say that it appears that Johnson & Johnson's vaccine, that single dose, provides up to 8 months of protection at least. But again, the company has not said whether they are seeking approval for that second booster dose. Carolina Cruz, KCTV5 News.
Very interesting. Carolina, thank you.